Most students walk into the NCLEX believing it's a memory test. They think success depends on how many facts, drugs, or lab values they can cram into their head. But the moment the exam starts, many realize something feels off. The questions don't ask what you memorized. They ask what you would do when a real patient depends on your decision. Welcome to the Learning Studio, where we don't just teach theory. We show how knowledge turns into real-world understanding. The NCLEX-RN exists for one reason only: to decide whether you are safe to practice as a registered nurse. It is not interested in perfect recall. It is interested in judgment. Can you recognize danger early? Can you prioritize correctly? Can you act in a way that protects the patient when time and information are limited? Think about driving a car. You don't need to know how every part of the engine works to drive safely. What matters is recognizing signals. A red light means stop. A warning sound means something needs immediate attention. Nursing works the same way. The NCLEX is testing whether you can recognize those warning signals in patient scenarios and respond before harm occurs. At the bedside, nurses are constantly making choices. Which patient needs attention first? Which symptom is expected and which one is a red flag? Which action can wait and which one cannot? The NCLEX simply turns these everyday nursing decisions into questions on a screen and asks you to think like a nurse, not like a student. Under the surface, almost every NCLEX question follows the same core principles. Patient safety comes first. Airway, breathing, and circulation guide priorities. Acute problems are addressed before chronic ones. Unexpected changes matter more than stable findings. You are not being tested on knowing everything. You are being tested on thinking clearly with the information you are given. This way of thinking does not stop after the exam. Hospitals use the same logic during triage, rapid response calls, and shift handovers. Many new nurses struggle not because they lack knowledge, but because they struggle to prioritize under pressure. The NCLEX is designed to identify that gap before it reaches the bedside. When facing an NCLEX question, strong nurses mentally follow a simple process. They ask themselves whether the patient is stable or unstable. They identify what could cause harm the fastest. Then they choose the action that prevents that harm first. This mirrors real nursing practice, where assessment comes before intervention and safety always overrides routine tasks. Now that you understand what the NCLEX is truly testing, the next step is learning how nurses assess patients systematically, starting with vital signs and early warning indicators. That is where clinical judgment begins, and that is exactly where we will go next here at the Learning Studio.